Okay, so we are going to be giving Mary Smith Zolfran for her nausea. Mary is allergic to morphine, which is a Zolfran, so that's not a problem. I looked up my medication already, and I did my dosage calculation. So she's supposed to get Zolfran 4 milligrams IV push every 4 hours, PRN for nausea. So she's going to get 1.6 milliliters. So I got all my supplies, my syringes, my medication. Medication is not expired. It's 12 of 2030. And my syringes are all not expired either. So I'm going to get dose accurate so that I can do my 5 checks 3 times. Okay, so I have 1.6 milliliters in here, and I would get all of the bubbles out. Check it. See? Mm-hmm. Okay. Alrighty, and then I would recap the syringe. And since I'm dose accurate, now I can do my 5 rights 3 times. So Mary Smith Zolfran 4 milligrams, which is 1.6 milliliters. IV push every 4 hours for pain, for nausea. Mary Smith, allergic to morphine. Zolfran, hold on. Got a tickle. Okay. Zolfran, 4 milligrams IV push every 4 hours is needed for nausea, and that is 1.6 milliliters. Mary Smith, allergic to morphine. Zolfran, 4 mg IV push every 4 hours is needed for nausea, and 1.6 milliliters. So I have all of that done, and I have all my supplies. So you can go into her room. Knock, knock, knock. Provide privacy. Wash my hands. Hello, my name is Anna, and I'm going to be the student nurse today. Can you please tell me your full name and date of birth? And everything matches. So according to your chart, you requested something for the nausea. The doctor ordered Zolfran, and you can get that every 4 hours. Does that sound correct? She said yes. Do you have any allergies at all besides the morphine that you listed? No. Okay. So she has her PICC line for her long-term IV antibiotics that she's getting, so it can stay. Or it should stay. Okay, so the Zolfran may cause some dizziness and arrhythmias, so be watching your EKG, and just let us know if you need to get up and we can help you, just so we can prevent falls. Do you have any other questions? She said no. Okay, so I'm going to wash my hands again and apply my gloves, and then I'm going to inspect the site for any infiltration, any redness, signs of infection, and she doesn't have anything. It all looks good. So I'll remove my gloves, wash my hands, and then I'm going to re-put on my gloves. And then we can start. Okay, so I would make sure that all of the air is out of my syringes, all the air and all the bubbles, which I don't have any. If she had heparin, I would use an empty syringe and get the heparin out before I injected the normal saline. So I will clean off her port. And I would clean it off for 15 to 20 seconds with an alcohol swab, depending on agency protocols. And then I would also make sure she had anything else running, that the Zolfran was compatible with it. and Zofran, according to the medication drug administration book, does not need to be diluted. So take off the cover. Already alcohol wiped it. Tie this, unlock it. And then I would pull back a little bit just to make sure that the line is patent and make sure that there is blood in there, which it is. So then I can inject the normal saline to clear the line. Block it. Off again. And then according to the drug book, I have to give this medication over 2 to 5 minutes. So it can, and I would give it over that rate, but for the time, we're just going to give it all. Get back up. Clean it off again. And then the flush right after the medication, I would do it the same rate as I did the medication. But for now, we'll just give it all again. And then this last one, I would pulsate it about 1 milliliter each time. And as I were giving the medication and following the medication, I'd be watching for any adverse reactions to it. And then I would clean up all my supplies, take off my gloves, wash my hands, make sure that she's comfortable and safe, bed's in the lowest position. So I'd raise her up and she has her call light. Afterwards, I would document date, time, what I gave her, why I gave it to her, how much normal saline I used for the flush, or for the flushes, and then where I gave it, so in her central line. And then an age consideration would be if they were younger, like an infant, you would not have to use as much flush according to whatever your agency policy is, because there's a shorter distance of the line. I think that's all.